What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Skin health, especially female skin health, but skin health in general. I brought in an expert on Carboxy CO2 based skin healing and skin health, Miss Lana Kerr.
While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
Welcome to the show.
Thank you so much. It's good to be here.
Absolutely. So tell us a little bit about your product line and what motivated you to create it.
Okay. Well, so first of all, my educational background is in accounting and finance. So that's where I started my professional career. Went back to school, studied nutrition and open weight loss clinics. So for the past 20 years, we had around 10 throughout Florida, 10 centers. And then, we've treated over 30,000 people through that program. We had 100 coaches that worked with me. And then, when people started losing weight, they started, having a different perception in terms of how they wanted to look and, taking better care of their skin. So we decided to open a spa and just looking for something that was unique. As our weight loss system, we discovered carboxy therapy. And that's pretty much how I kind of got into carboxy therapy, which even though it's a very old protocol or practice, it's still very new in the United States. They're just trying to understand it. But
Right.
Yeah.
Awesome. And so you founded that around 2015 or 2016?
2015 is when we started the company. We launched it in 2016.
Okay. And it's based out of Florida, correct?
Correct. So we have, we have reps throughout the country. We have 53 reps that sell directly to physicians. And then we have also another version that you can get on our store. But the vulva-vaginal product is the same that you're getting at a doctor's office.
Okay, awesome. And in terms of toxicity levels, are there a lot of synthetic chemicals that are endocrine disruptors, things like that?
There are no endocrine disruptors. Carboxy therapy is the therapeutic use of carbon dioxide to regenerate the skin. So, we talked a little bit before on peptide. We have some peptides in there, ceramides in there, but really the mechanism of action is really the CO2. When you mix the two gels together, it creates CO2 gas, and then it's just supplied to the skin, and that penetrates to the microcirculatory level. And so we're affecting microcirculation, and that's going to regenerate the tissue very quickly because a very natural process takes place once you introduce CO2 gas into the skin. Hemoglobin drops off the oxygen and picks up the CO2. So that's why blood supply increases. We're actually just started a perfusion study. What that is we're measuring how much oxygen is in the tissue after we introduce CO2 in gel in. So we're doing it with venous ulcer patients who have very low levels of oxygen. And this is just preliminary. So what we're doing, we put it on, and however the mercury level is, basically what we're showing is 100% or more increase in oxygenation of the tissue after you remove the gel. So what we want to know is how much does it stay, how is it at 4 hours, 8 hours, 16 hours, 24 hours? And then even after you put the gel on, how wide of a coverage it is. So that's going to help us with developing better protocols for surgeons in particular.
Right. And so if someone starts, let's say I started your product today or tonight, how long does it, I know you said sometimes the first application, you can see a difference,
Yes.
but in terms, is there a cumulative effect in terms of do the benefits build over time?
Yes, for sure. So first of all, so some of your listeners maybe on trying to understand what is it doing. So carboxy therapy is, think of a hyperbaric oxygen therapy. Some people, a lot of people understand that, you know, when you fill your tissue with oxygen, it's going to help to increase healing and circulate skin turnover. So people would do the CO2 lift as a standalone, pre and post procedure, or just healing. So for the standalone, we have invested in many clinical studies to see what is actually doing under the skin. You can see a difference after one treatment, because one of the big things about CO2 lift is the hydration level. It increases hydration in the skin over 117%. So that looks like, if you think about it, you think of a grape raisin. It's like, think of a raisin shriveled up, it kind of like filling it with water, because what's the difference between a grape raisin and water? You can fill out your skin. So that's one of the things you're seeing. So you're seeing this glow, you're seeing a reduction in fine lines and wrinkles, you see it immediately. And then, you know, if you do a series of 6, which is what we call a complete skin reboot, within a month, you'll see an increase in elasticity, which is about the skin bounce back. You're going to see 26%. No, nothing else does it. Not even if you use an energy-based device. After 3 months, you're not seeing those type of results. So 6 treatments, then you can maintain it with monthly treatments. But it depends on what you're trying to accomplish. The more you use, as you mentioned, it has a cumulative effect. So it builds on top of the other, on top of one another, and it actually, you see a better result. Your skin just looks better. It has better bounce back. So that's kind of what you're seeing, and it can be used anywhere on the body.
And when you say 6 treatments, 6 applications,
Applications, yes.
so how long would you wait between one application and the next?
So in the skin reboot, and based on our clinical study, they did 3 within the first week, and then 1 a week after that for the next 3 weeks. That's how it was done. We talked a little bit about, say, a healing ulcer, just to give you a diabetic ulcer. We had non-healing wounds and we applied it. These wounds were terrible. I mean, if you go on our Lumis website, you'll see some of the pictures, but they closed within a month after 12 applications, so 3 a week. You can do CO2 lift every day if you wanted to. It's just a matter of what you can afford. I mean, but typically the closer span of time that you do it, it's going to build on each other faster.
Okay. And how many products do you have in the line?
In the line, we have the CO2 Lift Pro, which is what a provider would carry. We have the regular CO2 Lift that's sold on our website that is not as concentrated, and it doesn't have as much brightening agents in the skin. We have the CO2 Lift V, which is a vulva vaginal. We have the CO2 Lift Moisturizing Mousse, which the tin has carbon dioxide in there. And, you know, there was a great article written by Laura last year, which showed a lot of the major companies like L'Oreal, for instance, they're looking at including CO2 gas with their products because better penetration. So that mousse is a great daily application of carboxy therapy with great ingredients, ceramides, peptides. It has over 80 different great natural ingredients that are great for the skin. So we have that. We have the tablets, which is similar to visiting an onsen in Japan. You can put in your bath and getting a CO2 infusion, or you can put it in your shower and get it in your hair for scalp issues. So how many did I count? Those are the carboxy products.
Okay. Awesome. And in terms of improving elastin, you said it improves elasticity. So it's increasing elastin. Is it also increasing collagen?
Collagen and elastin. So it's pro-collagenesis taking place, neoangiogenesis. And that's why one of the reasons they're using it for and vascularity, they're using it for erectile enhancement. So we've had physicians who, use it on, male genitalia, and they're getting improvement in shim score, 5 to 12 points. They're getting stronger erections. They're getting smoother skin, just more, it's more sensitive to the touch. So it's increasing for men as well, although that's not our focus, but yeah.
So I know a lot of my listeners and followers, they do PRP with microneedling, things like that, vampire facial. How would you say this compares?
So PRP, depending on your age, right? The quality of platelets change, just like anything in our bodies. So if a younger person and they're healthy does PRP, it's great, right? I think what this is more compared to is jet fuel. So they can combine it. So many physicians combine it with PRP because you're going to get it into the tissue quickly. However, even as a standalone, I feel, and maybe I'm biased, that it's superior because of the fact that, first of all, it's costing less than the PRP because that's a process. You're going to have more consistent results. In addition to bringing growth factors and stem cells to the area, but it's also increasing, as I mentioned, increasing everything in terms of skin quality. And you're seeing the results pretty quickly. And you can put it on top of skin that you don't need to puncture. PRP, generally, you have to microneedle it in. CO2 lift is getting through the skin membrane without puncturing the skin. So
Right.
you can use in combination, but as a standalone, it's just better all around.
I hear advertisements on the local radio for Decadot CO2 laser resurfacing. Are you familiar with that?
Well, CO2 laser resurfacing does use CO2 in there, but what we do in conjunction with that, many providers use this immediately post. So if they're doing a fractionated CO2, they can use it immediately post. It's going to help to reduce the downtime and enhance the results, because why are you doing any type of energy-based device? You're trying to control damage to the skin to promote youthful skin. So it promotes healing. You can get the same promotion of healing without damaging the skin. But I always like combination therapy. Combination therapy works better than 1 + 1 = 2. It's like 1 + 1 = 20, and it's just
Right.
compulsive. So if you put the CO2 lift with any of the, whether it be energy-based devices or whether it be like a PRP type of thing, even some people are talking about exosomes, if there truly are exosomes, then this is going to only help to speed everything up the process because it's a delivery system.
Right. Awesome. And I know you mentioned that some doctors and healthcare providers are using it for erectile dysfunction or just to enhance overall erection quality. So would that be the same product, excuse me, same product that women are using on their vagina, or
No,
is it a different product?
it's the same one that we're using on the face or the body. The vulva vaginal is different because the pH. So the pH for the vagina is around 4 to 4.5. So that's the pH of the CO2 lift, because we want to keep, and then especially as women get older, the pH changes. So we want to kind of bring it back to where it should be. Also, there is another product inside of there, another ingredient that helps with inflammatory issues that a woman may have, Japanese mugwort. So that's in it. And then of course, it has an applicator. So we have to actually insert it. So for the vulva vaginal, it goes inserts similar to a tampon. The rest goes on the vulva to the perineum. So that's what's used there. But for the CO2 lift face and body, that's what's used anywhere in the body, including male genitalia. It can be used in the anus too. So for that, for in terms of elasticity in there, in terms of even hemorrhoids, it's been used for just that air tearing in there. So yeah, you can use the CO2 lift anywhere. The vaginal is just the pH, really is what we're looking at, separating it.
Right. And how often do you personally use the CO2 products?
I use it. Okay, so I use the face practically every 7 to 10 days. The reason why I started doing it more, when I turned 50, I used to just use it once a month. But I think that obviously I'm the face of the company. I need to look at my skin, and my skin does, I have dermatologists who have known me from we started, and they will, just based on my skin, that they will buy it now, because they're like, Lana, your skin has improved. Also too, I have a condition called vitiligo, which I can't use any energy-based devices on my skin, which I used to use before. So now I don't want to trigger any new lesions, or especially on my face, so I don't use anything else but the CO2 lift.
Okay.
For the vaginal, I do it once a month. I did the series, that's what we recommend, which is 10 over the space of 2 weeks. And then I just maintain it with a monthly treatment of the CO2 lift V.
Okay. Awesome. And how many are you guys in every state in terms of healthcare providers?
Yes, we're in every state. We're in Canada as well. We're in Europe. We're in Saudi Arabia. We're in different countries as well.
Awesome. And in general, have there been any negative reactions to the skincare products?
No, it's not. So it's basically the product is benign. So it doesn't have any contraindications, which is always like, how could on, but it doesn't. I would say that even in the course of the time that we've been in business, we probably have maybe 4 or 5 people who have been allergic to oranges because orange oil is in there. So they will see us, and then they just say Benadryl and it's done. So it's nothing that's permanent. But we've been used on most sensitive skin. They use it right in surgery on open skin. So it's pretty safe product. It's, people who've had, talk about vulvovaginal issues, lichen sclerosis. Really, there's no, besides corticosteroids, there's really no treatment. I mean, they do use PRP sometimes there, but the CO2 lift V has been very effective for getting rid of the symptoms of lichen sclerosis. So you look at sensitive things like that, and we're definitely been effective.
Absolutely. And in terms of something that you're working on, are there new products that you're working on? Are you looking to expand the product on?
CO2 lift carboxy is still very new. I think one of our biggest things in the next 5 years is really a lot more education. We are coming out with the CO2 lift pro body just because of surgeons are using it after they do a mommy makeover. So we just need a larger, it's in a jar. So they put it right on in the OR. So just to make it easier for them. So we're coming out with that in the fourth quarter, but for other carboxy line products, I think our mission really we have still a long way to go in terms of education as to what it's used for, so people can see it as a category. We want to make it standard of care in physicians' offices. So we have our work ahead of us to continue to do that education.
Right. And now do you have healthcare providers and doctors reaching out to you?
Yes, we do all the time. I mean, we have, as I mentioned, we have over 50 reps, and we get a lot of leads intake. So they want information, they want demos. So we do have that. And of course, we're at a lot of the more premier meetings for plastic surgeons or dermatologists. We're very rarely at gynecology meetings. In fact, I think this is our first one in a long time. We're doing the Menopause Society in Chicago. That's coming up in September. And we found it a challenge working with many of the older gynecologists who see the vagina as simply, a way to deliver children as opposed to women's pleasure and women's health. So this year we're there. We just completed our third clinical study. We had 50 women in that study. It's another double blind. We duplicated what we did before, except that we added stress incontinence as a way to measure the difference in bladder life. And we found very good results. Of course, the women that used the ultrasound gel, so a double blind study for your listeners, the patients don't know what they're really getting. If they're getting the real thing or if they're getting the fake thing.
Right.
And the investigator doesn't know what is used as well. So we do questionnaires as well as biopsies. But the questionnaires, the women that got the fake gel showed no change in sexual function. All the women that got the CO2 lift V showed significant change in arousal, in desire, in lubrication, in orgasm. The biopsies of that tissue, it's just thicker epithelium and just 10 treatments. I mean, they just look like they're women in their 30s. And these were women who were postmenopausal. We use women between the ages of 40 to 70 in this study. And all the women that use the CO2 lift showed dramatic changes in the tissue.
Okay. Awesome. And in terms of post-surgical healing, what's the timeline there? I mean, is it being applied every 3 days, every 5 days?
So we just completed a consensus study from just physicians and how they're using it, and everyone kind of changed it a little. We're putting out a new protocol based on the consensus of, we had 25 physicians, just some of our top through dermatology, plastic surgery, that are using it. I think again, I was just telling you, I just did a vaginoplasty, and for those women, a vaginoplasty, what is that? So it's different from a labiaplasty. It's vaginoplasty is inside. So there are three components to sexual health. There is the tissue, which deals with lubrication. So CO2 Livy works great with that. You can have, by using the CO2 Livy, you can have sustained lubrication for 3 hours or more. I mean, that's just remarkable. So
Right.
that's tissue. Then you have, so that's, you're talking about, that's the clitoris. Then you have the vaginal tissue, vaginal thickening, which, so women will say, oh, I feel tighter using it. It's just that their tissue is thicker, because the tissue in the vagina is just like the skin on our eyes. It's very thin. And so it can get dry and brittle. So the CO2 lift helps to plump that up. But then there's also the muscle. And if you think of an elastic band, if you have kids, and I have kids, that elastic band pulls out, pulls back in. Even if you didn't have kids, if you put an elastic band on the table and come and revisit it in a year, that elastic band doesn't stretch the same way. So I mean, typically I'm not the person who would go for a vaginoplasty. In fact, when they measured the pressure in my vagina, it was a 6. Typically a woman will go in for a vaginoplasty when it's a 0 to a 3. But again, I'm always, I'm in this business. I always want to be ahead of the curve. Eventually I would think I would do it. If I would do a facelift, why wouldn't I do a vaginoplasty, like a lift for my vagina? So that's why I did it. I applied 15 CO2 lift treatments. So I did one every day for 15 days. And why did I do that? Because I wanted it to heal very quickly. Typically the healing time is 8 weeks. My healing time was 5 weeks. So I did one. But for healing with a facelift, or if you do a mastopexy, or if you do liposuction, or if you do a tummy tuck, they apply it immediately in surgery, and then they give the patient to carry home. And typically what a physician, I see they're doing 6 in a row. But the more you do, it's like going into hyperbaric. You're going to get some benefit but the more you do, the better. This is cheaper than hyperbaric. Also, you can do it at home. So the more you do, the better.
Awesome. And in terms of using it for just overall, I mean, obviously it can be used on the face, but can it be used to increase collagen and elastin, say, just on the arms for loose skin?
Yes, anywhere, the neck. I always say to women, make sure to do your neck, your hands, your knees, your anywhere that you think, your arms, it's going to help to make that skin look better, and just the quality of the skin. So,
Right.
we talk just as a standalone, but I mean, I know that they're using it when they do, brachioplasties, when they do, even if they do full body liposuction and they're doing the arms. So you can put it on to help heal, to get rid of the swelling and the bruising. So yes, you can be used anywhere on the body. If you're doing a fat transfer, what happens oftentimes is the fat dies off because the fat needs oxygen. So they would, to control the results and to get better optimal results, you'd put the CO2 lift where the fat was transferred. So if it's a BBL, you put it there if you want to keep a lot of fat, or on the face, or anywhere in the body, the breast tissue, you put it there, and it helps to really to oxygenate the tissue there, to keep the fat alive so that you can maintain the fat that you just transferred.
Okay, awesome. And in terms of products or where the skincare line is headed overall, I know you said you have to increase education, and that's a barrier, but do you see your company developing more products in the future?
Yes, of course. I mean, Carboxy, I don't know about Carboxy products right now. We have other products that we do. We have HA products. We have a facial oil product. We have wipes. We have, yeah, we would look at, we're looking at a vitamin C. We're looking at other products, but they're not in the Carboxy line.
Gotcha. Okay, awesome. What's something that you know today that you wish you would have known 10 to 12 years ago?
Oh my gosh. What is some 10 or 12 years? So I was at that time would be 40. What was something that I know today that I wish I knew? I grew up a lot in my 40s. So if I was to maybe go back a little further, I would say, first of all, take better care of your neck. Your neck and your hands, like start early. Like I didn't do that. But even just from a living standpoint, just be more authentic, just you're your own superhero. Everyone has their own unique personality. And
Right.
don't be afraid to just be who you are. Not everyone is going to like you, but you don't need everyone to like you. And I
Right.
think when I was younger, I used to feel compelled to please people. So I would refrain from not necessarily being my true self for that reason. And, I think that it served me better when you're just being more authentic. So,
Yeah. Like Joe Rogan says, honest discord trumps dishonest harmony.
yes.
I would rather have a little conflict now than a huge blow up a year from now or 6 months from now. And to your point about people liking you, not liking you, I mean, no matter how much good you do in the world, there are going to be people, especially on social media, that come out of the woodworks, trying to throw shade at you. And I mean, you could be the most philanthropic person in the world, giving away millions of dollars, and someone's going to have something negative to say. So if you can lose, at what you don't want to do, you may as well just go ahead and do what you were going to do originally.
Exactly. And even I think even in personal relationships and I'm married, and I mentioned that to you earlier. I'm married now. This year will be 27 years. I think even in marriage, I mean, as much as you think, you are kind of together, I think it's only in the last maybe 10 years that I am just truly who I am. And I'm not trying to I mean, you want to be tactful in the way you disseminate information or share what your wants are and that sort of thing. But I think it took me a while to really be myself, even with my husband. You think you are, but and I had the conversation with him the other day. I mean, I change every day. I want to be free to say, yeah, oh, you weren't that way yesterday. No, I wasn't, but this is who I am today. You know what I'm
Right.
saying? So I think that I would tell my younger self, even married, just to be really try to be yourself. And the thing is, the real problem is, Tim, is that we don't even know who that is sometimes. You know what I'm
Right.
saying? We don't even know who our real self is. So just spend a little bit more time reflecting on who you are and meditating on that, and so that you can understand yourself. And I didn't understand myself until later on in life. And I wish I spent a little bit more time in my 20s really understanding who Lana is.
Yeah. I think it's easy to kind of lose yourself and have your identity tied up in other people and other things. But we're human beings, not human doings. And, slowing down, I think that's good for the skin too. Rest and rejuvenation.
For sure. For sure.
Awesome. Thank you so much for the work that you're doing. And we'll put up all your links. If people want to check you out real quick, where can they find you?
They can find, well, first of all, my direct Instagram is the Lana Kerr. And, I'm good if they have any questions on this. I'm good at responding to my DMs, but our company is at CO2 Lift and at CO2 Lift V. As well as, and I didn't ask you about this, Tim, is that if you wanted your audience to get a discount code, we can create one
Yeah.
for them. So they would
Yeah.
they would visit the co2lift.com, and when they check out, we would get a code, and we could do Dr. Tim 10.
Okay.
Yeah.
Yeah.
So yeah,
That
Dr.
would be
Tim,
great.
I'll send that to you after, and you can put it in the show notes for 10% off. And feel free to either reach out through Instagram or email support, and we're really good at responding as well.
Awesome. Well, thank you so much. Keep up the great work, and we'll have you back on in the future.
I love that. Thank you so much. You were such a great host.
Thank you. Have a blessed day.